Hello everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric O'Kelly. This week, we are with Tanguy Bader from New Orleans. He is a second-year BSc Paramedic student, a U.S. paramedic, and currently here in Malta. Tanguy, welcome to the program.
Thank you so much, Aebhric. I appreciate you having me on.
So tell us a bit about yourself and what's keeping you busy.
So right now I work for New Orleans EMS as a paramedic on the streets, doing 911. Right now I'm just taking 2 months in order to be able to come do this course, and following this week I'll be going to do my clinicals in Tanzania. When I'm not working, I'm usually studying for the course and trying to fit in some fun in the meantime.
So you've been here for a bit, haven't you? What have you been taking here in Malta?
So this is week 2 for me. I started doing the eye care course, which was absolutely wonderful. It really surpassed my expectations. All the people that I learned countless things from everyone in the course, and now we're working on TTEMS, which is a little bit more of the basics, but basics and stuff that I have no experience in. So a bit more clinical in the clinic stuff, as well as the tropical stuff, which is really interesting.
What have you been learning in year 2 that you didn't learn in your U.S. paramedic program?
Wow, that's a big question. I feel like every week I go to work and I tell my partner about something new that I learned in school. Even just a couple minutes ago, we were learning about different methods of auscultating and assessing the abdomen, as well as a more thorough neuro exam than I was ever taught in school. I really feel like I can use a lot more nuance in my assessment skills as I did from is the person breathing or not from school.
So what's a major take-home that you brought from the eye care course?
From the eye care course, I think the big things are going to be urine output and MAP being clinically important, because in the field every day, I mean, MAP is something that I rely on, but urine output is never something I think about. And just having a bit of a transition in my thinking about the patient being a bit more long-term, I'm monitoring for trending versus one single set of vitals being an important landmark, as well as, that's a big takeaway.
You did the APIS course as well, the ultrasound course. How was that for you?
Not yet. I do ultrasound at work. We actually just got cleared to start being able to do some fun new cardiac ultrasounds during our cardiac arrests. Oh. Yeah, we just got a protocol I haven't been able to try yet, but it sounds like we're going to be able to be trialing out some norepinephrine during pseudo PEAs with ultrasound confirmation. So I do ultrasound at work, but we were saving the APIS for year 3.
So what probe do you use at work?
We use the Butterfly 2. We haven't gotten the Butterfly 3 yet, but I'm excited to try it out. It's been a game changer. It's generally the difference between guessing and being able to see something.
So what made you choose the Quorum Paramedic program?
I mean, I feel like I've known that I've been wanting to be a paramedic for a long, long time now. And I searched for years to find the right way for me to do it. The local programs that we have available to us in my area mean that I can still continue to gain experience in the streets and work, but they don't really tailor to a more in-depth approach to paramedicine. It's more specific to getting your certification. So after noticing what my local resources was, I kept looking, and I eventually fell on Quorum. I had, throughout that whole paramedic licensing, I had in the back of my mind the idea that I would come and solidify more of my questions, queries, and curiosities, and desire to want to know more with COROM, and that's definitely been the fact.
So you've done this with a good approach. Like, you started out as an EMT, of course, as we all do, but you also did your AEMT before your paramedic. And then you chose to do your U.S. paramedic before enrolling with us. How was that pathway for you?
Honestly, I think one of the things I've tried to suppress in my career is trying to rush through things. I started off in lifeguarding, and then I went to wildland. And when I decided to get into the EMS field, it wasn't that I knew I wanted to do it the whole time. I just I knew I was going to be doing it for the rest of my life, so I wasn't in a rush to get it done. But getting into the EMT, I started with my remote EMT. So from the get-go, I had a bit of a mindset of doing more wilderness and austere stuff, coming from initially starting with search and rescue. So when I got to the field, I started off doing BLS 911, and it was a great way to get my foot in the door and learn how to take just a manual blood pressure while the ambulance is moving, be able to tell, is my patient sick or not sick, just from the front of the door, because I really don't have that much equipment, and being able to work with different agencies that have different perspectives and find my comfort level. Then I moved to New Orleans, and all of a sudden I'm working with a paramedic for the first time, which I had never done before, and it was quite, I wouldn't say intimidating, but it was eye-opening to find out the possibilities of, I feel like I'm stumbling around as an EMTB in the back of an ambulance with another EMTB trying to figure things out by ourselves. And here I have someone who I can look up to and be able to tell a lot more. So I took that first year to learn just how to be around ALS, and that was amazing. I had an amazing partner who has taught me an inordinate amount, and I had started a paramedic course, which unfortunately was not something that I wanted to continue because it wasn't the rigor that I was hoping for, and so I had a little bit of time. And New Orleans had just started an advanced EMT program. We had advanced EMTs working for us, but they weren't able to really work that much within their scope. And some of my colleagues decided to go up to our medical director and propose a whole new program in which AEMTs are really working to pretty much the limit of their scope in New Orleans, being able to give narcotics, being able to do a whole asystole code without a single paramedic being there. It really pushed me to do the advanced EMT at a quicker time frame. But before I was even a paramedic, I had a full year of ALS experience under my belt, which really was quite valuable, especially going into school, being able to see what I'm learning at school and paramedic school, and then being able to bring it to the streets pretty much the next day. It was good. One thing I will say is that you have to really be able to be on top of what your scope is when you're mixing two different scopes, one at school and one in the streets, is definitely something you got to pay attention to.
How long was your advanced EMT?
I did it through North American Rescue, so it was really quick. It was 4 months of really, really quite intense studying. It wasn't very fun for my friends at that time, but I got through it, and we went through quite rigorous process of changing your mindset from being a BLS provider to an ALS provider. And once we got through that, then I was still with a paramedic just because of how the scheduling was done, but it really takes a lot of load off of both of the providers, and it means that you can work more in conjunction.
Did you do any of the wilderness programs, wilderness EMT, wilderness first responder? What did you do?
So I started off my first ever foray into responding to emergencies was working for the Multnomah County Sheriff's Office in Multnomah County in Oregon, and we did basically a woofer level. I did actually go out and get my woofer with Knowles at that point. So I started from the get-go. All of my first aid and medical experience was in the wilderness, and then I went and did my remote EMT with Remote Medical International, which was a great way of continuing that along. It's interesting because in my mind I think of myself as a wilderness and austere sort of medic, but in reality the most patients I've treated have been in a city. So it's kind of a weird mindset shift that you constantly have to be making. Is, do I have this patient for 15 minutes, 5 minutes, or do I have him for an hour? So it's a great way to look at it.
Did you look into the OHSU paramedic program?
I did not.
It says they're in Portland.
It is. I was trying to get a bit more of a varied patient contact base, and yeah, I like trying new places.
How was the remote EMT? Were you up in Lake Diablo?
I was actually at the other spot in Washington. I forgot, Leavenworth. I was in Leavenworth, Washington, which was fantastic. You spend a month there. You work hard. You go for some nice trail runs, and you get to do some fun woods time. But yeah, it was great. My first time ever being in a hospital doing clinicals. The instructors were wonderful. I think every course I've been in, I've made a bit of a reputation for myself for going wow when I learned something new. So that was definitely one of those courses.
So you've decided to enroll in the bachelor's program. So you skip year one because you're a U.S. paramedic, and now you're doing year two. Are you going to do year three, or are you going to skip year three and go into the master's?
The bachelor's has been something that I've wanted to do because of goals to do more international, and it seems like the world is sort of progressing towards that side of things. And I'm right now. I was just looking through the two differences, and both of them have so many great modules that it's kind of hard to choose. I'm quite dyslexic, so even just being able to do the BSc now is quite. I feel quite privileged to be able to do it. A lot of the way I'm able to do it is because of this new AI technology being able to read to me and get through the textbooks. So we'll take it 1 year at a time and see how that goes.
So what do you plan? So you're going to do both year two and year three. So you'll get a bachelor's degree. What do you plan to do with that? The
goal is, honestly, the main goal is to just every day be a better clinician. I don't see it fair to have a patient have better care, worse care with me than with anyone else. So I want to be hopefully giving the best care I can. They give me the privilege of being able to take care of them, so I'd like to give them the respect of giving that back. And then, in terms of career stuff, I'd really love to do more international work, hopefully do some more seasonal stuff, and just keep learning.
So what you're learning in year two of the bachelor's program is building on your NREMT paramedic. What learning or what skills or what knowledge are you bringing back from the college to your clinical practice in New Orleans as a paramedic?
I mean, it's every day. Last week we learned about assessing ocular nerve diameter to determine probability for increased ICP. That's something that I can genuinely bring back to work the next day. Have a discussion with my medical director over whether or not I'm allowed to do that. But it's tools that I can genuinely bring back to work the next day, as well as I'm doing the critical care modules online right now and learning about vents. And even before we just released vents in the field at New Orleans EMS, and even before we had done that, I had a foundation that I could build off of from the college, being able to understand the basic principles of vents. It's teaching me a lot about the subtle things too. Like I can look at someone's skin and be able to assess a bit more than just, is it red? Is it blue? Is it cold? Is it bleeding? Now I can see, that might be possibly scabies. That might be possibly some type of other infectious. Maybe it's a fungus. Things that I just thought were in a bit of a naive fashion, just differences in certain individuals, I can tell, no, that's actually pathology instead of physiologic variants. It's been quite game changing for me, and I think my partner's fed up of me telling her the new things I learn every day.
Nice. So you mentioned Vince. Are you looking at the IBSC board certifications to enhance your learning?
I am. Like I was trying to allude on earlier, and I don't know if I brought across, I try to hold myself back from rushing too much, and really focus on the basics before I move on to things. But we are getting vents in the field. Right now they're only for non-invasive ventilation, which is honestly, BiPAP is amazing. I would definitely love to at some point get the IBSC certifications. I think I'm gonna wait until I have a bit more ability to apply those skills so that they don't wither away.
Yeah, once you have 3 or 4 years under your belt as a paramedic, that's kind of the next logical step up. Would you look at board certification flight paramedic and get yourself a flight job in the States?
I mean, that both of those would be wonderful. I think in my shorter term planning, I think the wilderness paramedic certification is probably the first one I'll go for, because I'd love to get back into some wilderness and seasonal work, with hopefully the ability and the time to focus on that critical care piece after that.
So extrapolating out past 2 or 3 years, and then you get your board certification 5 years down the road, 10 years down the road, where are you? What are you doing?
Oh, the big dream is to be able to hopefully be on one of these UN EMT teams or some type of relief team. That would be quite extraordinary. Along with, it's hard to mix these two things, but also along with some type of modern large scope and critical care type job in which I can and really push the bounds of my scope with the best equipment, and then switch it off with having less equipment and being able to still bring those skills that I've developed to places where they don't have them. So,
have you considered PA school or nurse practitioner school in about 10 years?
Yeah, it's always something that I think about. I don't want to jinx it, but if they do come up with that equivalent for paramedics, that would be awesome to do. I was listening to someone talk about
David Pfeiffer.
Yeah, in the UK.
Oh no, so the UK already have master's level paramedics.
Yeah, so I was listening to how they can get their non-medical prescribing and stuff like that.
So they do a master's degree in advanced clinical practice to get their ACP, and then they get registered with the ACPC as a advanced practice paramedic, and they're treated basically like a junior doctor.
Yeah, I mean, I'm trying to balance the. I would love to do that. I love paramedicine because you have some independence, you have the ability to make decisions, but you also have the ability to spend 30 minutes with your patient, talk to them. You get to see how their house is. You get to see what their family's like. The family pulls you to the side, says, "Hey, I've been concerned because they haven't been eating." You really get a one-on-one interaction with that patient, and that to me is huge. The ability to have a more thorough understanding and a broader scope is definitely interesting to me. But I guess we'll see how scopes and things evolve.
It is an honor to be invited into the intimacy of these people's homes, and you see them, and you see where they're living, and you see very private details of their life.
Yeah, I mean, I feel privileged every day that someone can trust me to walk into their house and take care of them, and not even just them, take care of their daughter, their son, their grandmother, in very vulnerable situations, and yeah, I just, my goal is to be able to take care of them how I would want my family member taken care of. So, yeah, it's funny. I try and convince a lot of the ER nurses to come do ride-alongs, and the first thing they say is, "I don't want to be in someone's house." But to me, that's a fascinating way to live, especially in New Orleans, where you have these old houses that are, tiny in some respects, and just full of just amazing art and family history. It's really quite interesting.
Think back over the time you've been a paramedic, or all the way back from the woofer on forwards, and tell us about a memorable patient you had.
I mean, it's coming on 10 years now of doing emergency response work, and the patients that I remember are the patients that I can make laugh. I can meet them that, they the other day I got to meet one of the first ever female underwater welders. That sort of thing, like the people aspect of it is that memory, and then the patient experience aspect is usually, the first time I intubate, the first time I needle decompress. I remember those moments, but it's also the moments when I think about what I could have done better for the patient. So recently, maybe not too recently now, had my first ever solo cardio version and pacing on the same call. And as the laughing suggests, it was a bit of a cluster. But at the end of the day, the patient got to the hospital alive. We learned some things along the way, and I'm more attuned to how to better treat the next patient.
Looking back at the time you've had in the college for now, so you're just starting out in year 2, what would you improve? If you had the ear of the executive dean, what would you tell him on how we can have made that experience better for you up to this point?
I mean, the reason I love this college so much is because you're directly studying paramedicine, or the topics that you want to be studying the entire time. The people, once you have contact with them, are so knowledgeable. They're all out doing wonderful things at the same time as teaching. But in that same vein, I think communication and just ability to have someone's ear a bit more of the time is always more desired. But it's a fine balance between these amazing instructors being able to do cool things and being able to be at the computer all the whole time at the same time. So yeah, I think it's part of the aspect of being remote and being online that's sort of inevitable.
I stumbled on a YouTube video of yourself and you were speaking on the EMS World Conference, and I noticed, and I was impressed, that of the 8-minute video, there were hugs all over the place. Like the whole place, you're walking around the emergency department, your ambulance bay, and how amazing is that to work in? So first, tell us about that video, and then tell us about why is it that your workplace is so, it looked joyous.
It really is. I mean, the video was supposed to be like a way for EMS World to put a spotlight on New Orleans EMS, and because they were coming to New Orleans, so that was why they were doing it. If you watch the video, it's a little cheesy because I nearly came to tears describing the community that New Orleans EMS has, despite every agency having their grumbles and mumbles. And the reason I wanted to work for New Orleans EMS was because on my initial ride along, no one told me, hey, you shouldn't do this job. Hey, this is a terrible job, which is in EMS, it's pervasive. There's a lot of people out there who don't take joy in their job. But at New Orleans, I was greeted very well. And, I'm happy to work with everyone who works there. I feel like we definitely accept each other as a team, and I've been able to be on a couple watches now, so I think I've gotten to know pretty much everyone. So yeah, it's a big family, especially that relationship you get with your partner in ambulance 911 stuff is, you work with that person less than 6 feet away or less than 2 meters, however you want to take it, for 40 hours a week or more. You spend more time with them than your significant other, and you can, you're bumping into each other all day, and you just develop. I would do anything for my partners.
So you moved from Portland. I lived in Portland for a while. I've studied in Portland. It's an amazing location. What made you decide? You woke up one day and you're like, you know what? I'm going to New Orleans. Did I say that right? New Orleans.
It's New Orleans, and I probably say it wrong. Turns out you can't just put a French accent on things and it'd be right. There's a couple hilarious street names like Calliope and Burgundy. But yeah, so I grew up kind of a little bit all over the place, spent some time in Southeastern Africa and the UK, in the Isle of Man. So Portland was really, I was only there for 4 years. I did high school there, and that's when I started search and rescue. Before moving to New Orleans, I moved to San Diego to be a lifeguard for a season, which was an amazing job. If you could do that for full time. Then I went to Australia to do wildland, and then Alaska to do wildland. I had just been to DC to get my foot in the door during BLS 911. So it was more just being able to stay in the U.S. And New Orleans has a fascinating city in terms of the people that are there. In a lot of ways, there's a lot of sick people. In terms of chronic illness and as well as trauma. So it had that side of things, but also it's a third-party EMS. So I really prefer working for the government, even though we do charge. That is the disappointment of working in the U.S. So
you said Southeast Africa.
Yes.
And you're going to Tanzania. So you're going back. So how were you in Southeast Africa? And what's it like for you going to East Africa?
So we lived in Mozambique for close to 10 years. We lived in Malawi, the Gambia, and DRC. That's why we speak French. So it's definitely, it feels more like home, but it's been 10 years since I've lived there. So it's nice. It feels, I have my comfort food, which is nice. My brother used to live in Kenya, so I have some experience with that area. I'm really excited to go to Tanzania and check out KCMC. Yeah, I'm just excited to be able to be in a place with a bit more fresh air, hopefully.
There's a fair amount of fresh air coming off of the Mount Kilimanjaro. Yeah.
Well, elevation is something that's sort of new to me at this point, considered New Orleans.
Yeah. Well, it's not too high. You're at the base of Kilimanjaro. If you do Kobosho, that's halfway up. So, Tanguy, my final question for you is this. What advice do you have for the new doctor, the new nurse, the new paramedic who is just starting out on their career in austere medicine?
I think the more I learn, the more I understand more. I understand the importance of the basic interventions and how important they are. So that means, for me, proper BVM ventilations are just so important. I honestly don't believe in single person BVMing anymore. It's so rare that it works. You need to have massive hands. So 2-person BVM ventilations. Make sure you get good chest rise and fall. A lot of people talk about this. It ends up being the person who gets the bag ends up usually being the person with the least experience on the team. They have one of the most important jobs on let's just say a code. For example, we're working an overdose, just getting those couple minutes of just beautiful oxygenation so that that patient wakes up not upset, not hypoxic. That's super important to me, and going along with that, hypothermia prevention is huge. It's something that, especially in New Orleans, often gets put to the wayside because it's usually not cold at all. But just the basic principles of and just keeping your ambulance clean, simple things.
So you just said be good at the basics.
Yeah, it's game changing. I can't. When I want someone to show up to my call, right? I call 911. I want them to show up with a professional demeanor. I want them to know where their equipment is, and I want the stretcher to not have blood on it. I think those are pretty simple things that you can ask for. And if someone's able to bag properly, if someone's able to get those basics down, I have more confidence in them being able to do the advanced procedures that I know, there's no way of someone being able to have those, halo events like Crike's down perfectly if you're only doing it once or twice every year. And I don't expect them to have it down, but, maybe having a checklist, being able to communicate appropriately with your team gives you more confidence in that provider. So that's my goal, to be able to make someone feel like I could take care of their grandmother just like I want them to take care of mine.
You definitely walk the walk that you talk the talk. You started out at a woofer, and then you went REMT, and then you went AEMT, and then you went NREMT, and now you're doing a bachelor's degree of paramedic. You personify this whole concept of doing the basics well.
I'm trying. I'm trying every day. I'm trying to learn. I think sometimes it may feel frustrating to review that stroke assessment for the 5th time in a row, but I don't see any harm to learning maybe one little thing out of that whole chapter one more time.
Tanguy Bader, thank you for being a guest. Thank you for being a fantastic student. It's been great. I always enjoy sitting in the back of the classroom and watching my faculty have a go at yourselves. And just this week has been quite interesting to see your pathway. I mean, all of the students have their own way of, some of them are touched, some of them aren't, but you have definitely taken this bull by the horns and you're grasping it and you're fully engaged in the classroom. And it's been a delight to watch you this week.
Thank you so much. I'm really trying my best, and if I can live up to any of the other students or any of the other people that have been on this podcast at some point in my life, that would be a life well spent. So thank you, Aebhric. I appreciate you having made the college and done all these things. Thank you.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.edu.mt.